This was in the research that my professor had conducted. And so basically these behaviors help promote that social resiliency that we were talking about, that collective resiliency. And you can see that some of the things we talked about are probably on this list: perceiving others accurately and empathy. I think I said that, and Joanne probably has something similar to that. Perceiving caring and respect for others, and having, Joanne talked about having the employees' needs met. And I'm not going to go over all of them, but I'll just pick out the ones that I think are important. So having trust, having tolerance, having values that promote the welfare of self and others. You can tie that back to the organizational culture. Does the culture fit in my values? The organizational culture fit with who I am and what I value? So I'm going to talk about a couple of things that actually help or hurt the ability to build that resilience. And in a study of military service members from 2001 to 2010, they actually identified these factors. So risk factors that actually harm a person or an organization's ability to be resilient include anxiety, depression, and perceived stress. So anxiety would be the fear of the unknown or just facing that uncertainty. And depression, I'm not talking about the actual clinical diagnosis of depression, but a state of being depressed. And I think when Dale Carnegie described it in his book, How to Stop Worrying and Start Living, he described depression as dwelling in the past. And then the other risk factor is the perceived stress. It's like, that is how an individual feels about the level of stress he is under at any point in given time. And now on the flip side of that, we have the protective factors. So we have optimism. Optimism is the confidence or feeling hopeful that things are going to turn out okay. And it's probably hard to feel optimistic right now. But I actually do have friends that I lean on to give me that optimistic perspective from time to time.
Yeah.
The other part of that leads into the social support. Do you have a social support system? Do your coworkers, from your coworkers to your friends to your family, do you have regular relations with them? Do you speak to them? How do they fit in your support group? And then your self-efficacy, which is basically the confidence you have to control and succeed in your own environment. So just a little bit of more research there.